What does a migraine sufferer's neck and structure look like on the inside? I just had a migraine sufferer come in as a new practice member. And what I wanted to do is I just got the x-rays, I screenshotted them, and I wanted to go through, in general, what I'm looking for and what a structural chiropractor would be looking for when they look at x-rays. Now, a couple of things before we get started. So really what I'm going to be doing is I'm going to be showing you what somebody who has migraine headaches, I'm repeating myself, but I want you to know what their spine looks like on the inside. One of the things that we are seeing with people who do come in with migraine headaches, and actually with all people, is there's a lot of people out there who have no idea what the structures of their spine look like on the inside ever, which is interesting because many of us have had car accidents and falls and traumas and concussions, and we were athletes and we have poor posture. We sit at a desk. Um, so it's just really interesting. But before we get to that, my name is Dr. Kresimir Jug. I am a structural chiropractor in London, Ontario, Canada. We help people with spinal related health problems find relief and get better through the power of structural chiropractic and life by design principles. And on this video, like I said, a in-depth look of the structure of a migraine sufferer's neck and head position. And now, a couple of things I want to pre-frame before we jump in. And you can see I'm recording, so you can see the x-rays here on the side. Number one, this is non-specific. So there are specific lines and measurements that need to be drawn to get accurate measurements. I'm going to be giving you, because I don't want to bore you with all of the details and the nitty-gritty. So I'm going to be giving you, I have normals, and I'm going to be showing you what the migraine sufferers look like, and we can quickly compare the difference. I'm doing this with the idea that I want you to be curious. I want you to be curious on what the structure of your spine looks like. I think there is tremendous value in knowing. And I mean, there's a couple of points that there's a couple ideas that are swirling around my head before I get started. That was one of them. The second one is, if there are structural abnormalities, if there are malpositioned or degenerated discs or vertebrae, I am not saying that that is causing this individual's migraine headaches. I am, however, saying that it's reasonable to suspect that if there's structural damage, if there is pressure on the nerves, it is not helping somebody with migraine headaches. Now, the two are very important that we distinguish, because here's what we know about migraine headaches, and I'm happy that this model is changing. We used to think before, and I've made many videos about this, but we used to think before that migraines were caused by changes in blood flow to the brain. So, I mean, if that's the cause, it's really simple. You just change blood flow and the migraine should go away. And that has not been the case. Now, of course, we know that people who exercise, I mean, that increases blood flow to the head. We know that people who take caffeine, that these things positively affect migraine headaches. But really what the model is now is it has more to do with nerve system sensitivity. So it's how reactive your nerve system is and how much damage is done to your nerve system that appears to be the primary culprit. Now, I'm saying this because if there are structural problems, we know that it alters the nerve system. We know that if there's pressure on the upper cervical spine, it changes the cerebral spinal fluid flow. So that is the flow around the brain and around the spinal cord. We know that it can increase or decrease pressure, putting uneven pressure on the brain. So it's not a one cause, one cure type of idea. However, I am saying that you're better off having healthy structure in your neck and having a spine that moves well. So with that being said, I'm going to go ahead and screen share, and then we can, that's the wrong button. This might take me a while, but we can go ahead and get started, okay? All right, so we can get rid of this. All right, hopefully this goes away too. So these ones here, and you can see my cursor. This is one of the reasons I wanted to do it like this, is you can see my cursor. So the ones on the left are going to be the ones of the patient that walked in, and the ones on the right here are the normal. So what you're looking at, the view here is called an AP, so anterior to posterior open mouth. So the person has their mouth open, and this is specifically designed to visualize C1, which is these two big bumps here, and it's hard to see, but this line going out here, and C2. And C2 is this bump and then this body here like this. And you can see these are the upper teeth. Here is the nose. Here is the bottom sets of teeth, and here is the neck. Now, here's what's important on this. It's hard to see, but we would like to be able to see the opening where the brain or where the spinal cord comes out. It's hard to see on this view. You can see it a little bit better on this view. But what should happen is we should have C2 lined up directly underneath that. And then what we should have is we should have this nice, healthy space underneath C1, in between C1 and C2. There should be even spacing. So there should be balance in the space between C2 and C1. So this right here, this is important because when you turn your head, most of the rotation of your neck and your head happen right here at this joint. And this down here is the spinous process of C2, and it should be in the middle. So if I draw a line straight down, and it's pretty easy to visualize, but you should see how everything should line up. So let's go over to the migraine headache sufferer. And here's what draws my attention first and foremost. Number one, when we look at those spaces beside it, this bump here is called the dens or the odontoid of C2. When I look to the space either side, you can see this space is much bigger than this space here. There doesn't appear to be a lot of disc space, or the joint in between C1 and C2 looks small. It looks as though all of C1 has shifted to the side. That's why if you look here, these ends line up where it looks like it here. And this is why making accurate measurements is going to be absolutely necessary, but it looks as though it's hanging off on this edge. And you can see that the spinous of C2 back here is shifted to the left. So this is the left. And you can see that instead of being lined up underneath like it is right here, it's shifted to the left. So that's what draws my eyes on this one. Let's go to the next one. So the next one is called an A to P cervical. And this is one where they are looking at the center of the neck. And what we should see here is a nice straight line. Again, you can see the posterior or the end tips of all of the vertebrae. Those are C2s. It looks like if we were to draw a line at the bottom of the skull, the head is on square. You can see that this is the jaw line here. But when we look at this one over here, what we're looking at and what we can see is there's an obvious curvature because the lines are not lining up, and it looks like her head might be rotated. So there is, the tip of the mandible here, which we can see here, but I don't necessarily see the other one, okay? And last but not least, to give you some idea of what it is that we're doing here, this is the one looking at the side. So this is the normal one. There were certain labels that we wanted to talk about, but this is a normal lateral cervical curve. There's good positioning of the atlas. There is your spine is supposed to have, the spine is supposed to be, if you're looking from the side, curves are normal in the spine. It's almost like they're reversed C's stacked on top of each other. So you have a cervical curve, which is right here that we're looking at, should be about 40 degrees. There's normal variations possible, but a simple rule of thumb is to have 40 degrees in the cervical curve, opposite 40 degrees in the thoracic curve, opposite 40 degrees in the lumbar. These curves are normal. When we look over here, we don't see a 40-degree curve. We see a flattening of the curve. It's possible that, especially here in the lower cervical spine, there could be even a reverse curve. The other thing that really stands out is when we go back to the healthy ones, the boxes are the vertebrae, and the spaces in between are where the discs are. So we should have thick, healthy, very clearly visible. You should be able to look through them and see through them. It should be dark. and the smaller the disc space, the more likelihood of degeneration. The vertebrae here looks like they have kept their shape really well, but some of the discs are starting to thin. So there's degeneration that's starting to happen. And of course, degeneration in your spine doesn't happen overnight. There are certain, it's a certain progress that happens. So the first step of having spinal degeneration is a loss of curvature, which is where we see with this patient. The next thing that starts to happen is bone spurs start to form and the discs start to get narrow. So it looks like we're on the way of that process there. So, and again, the concern is this. The concern when we start to have postural shifts, distortions, and degeneration, the fear on our part as structural chiropractors is that this is causing pressure or abnormal functioning of not just the nerve system, but like I said, the upper cervical spine. We know that if there is an actual shift, it can mess with the cerebral spinal fluid or the fluid around the spinal cord that should be flowing in and out to help healing and to, well, not just to help your body heal, but to help your body function normally. So when I draw the lines and when I have accurate measurements, I'm going to know exactly what levels need to be corrected and where I'm going to be targeting a corrective force to start helping the spine get back to normal, helping take the pressure off the nerve system, and hopefully helping this person do a whole lot better. Okay. So I wanted to show you that. I hope it piqued your curiosity, and I really do hope that it will make you find out what yours looks like on the inside, because I think it's tremendous value that most people have no idea about, especially like I said at the beginning, with all the trauma that we've experienced. If there's any comments or questions, please post them below. I would love to answer them and to start a conversation. I hope you're having a great day, and we'll talk to you soon.